Hi, thank you for coming to my presentation. Today we're going to be talking about ways to deal with low back pain. Low back pain is experienced by many people of all ages from old to young, so it is very important that we know proper ways to deal with it when we're faced with the pain and issues caused from low back pain. So first off, we're going to see what is low back pain. Low back pain is usually caused through some form of direct injury, and that form of injury can cause damage to your discs in your back. It can compress your nerves, and it can cause incorrect movements of your spinal joints. So every time you're moving, your joints aren't moving properly, which is going to cause you even more pain when you're trying to even get in a more comfortable position, and it's quite a hassle for everyone. And when you're experiencing the low back pain as well, your brain has a hard time telling the difference between what's going on back there. So like, say you have a damaged disc, your brain might think it's just a pulled muscle, even though it's something much more serious. Now, a few causes of low back pain we're going to go over. The first one is bad posture. Many people of all ages as well, again, suffer from poor posture, whether it be lordosis in the lower back or just bad habits they've picked up from slouching as a kid or something that begins over time affecting their back and how their body aligns. Their kinetic chain is all off. Another example that can affect your posture is being overweight. Can really affect your posture in a negative way. Quick sudden movements, by this I'm talking like a quick fall or trip down some stairs or something where your body's just thrown into a quick movement it wasn't expecting. You trip up, slip up. That can also cause lower back pain. When you're going to large forces of impact now, that's stuff more related to like a sports injury. Say you're playing football and you get tackled from the side, you didn't really see it coming. That can really affect your structural integrity in your lower back and your muscles, causing lower back pain. And then finally, we go to lifting heavy objects without a proper warm-up. Even if you have a good warm-up, sometimes when you're lifting a heavy object and you twist incorrectly or just twist a little bit, it can tweak that lower back, the muscles and the joints in there, causing that back pain to become an issue for you. So now we're going to be talking about ways of dealing with lower back pain. For this presentation, I'm going to be covering 3 of them, which is exercise, therapy, and a proper mindset when it comes to dealing with the pain and the factors that it affects in your life, which is often overlooked by many. So first, we're going to be looking at exercise. Exercises, as you can see, it strengthens your back, your stomach, your leg muscles, as long as you're doing the correct ones. Say you have lower back issue, you ain't going to go into the gym and start doing dumbbell curls. That's not going to really do too much for your lower back. You want to make sure you're doing the correct lower back exercises that will help your spine and your posture. These tend to be the lower back and core related exercise. So we're going to go over a few of the ones that you can use here. Partial crunches, hamstring stretches, wall sits. Actually, if you pan the camera over here, a wall sit, for example, is just going to look something like this, and you hold this position as long as you can, and it's really going to work that legs and keep your core and lower back nice and tight. It's a very good exercise for your lower back. Other ones are going to be press up back extensions, bird dog, knee to chest, pelvic tilts, and bridging. These exercises you can all check online or ask someone involved in fitness, like a fellow personal trainer or something, and they'll be able to show you the correct ways to do these exercises, because you do not want to be doing them wrong, because if you do them incorrectly, it can cause even more damage to yourself and more pain, which is not a good thing. So it's very crucial that you're executing the exercises properly. So another way when dealing with lower back pain comes to therapy. So therapy, you're generally using it not by itself, because therapy, although multiple forms, are just good for short-term relief. So without taking any further precautions, it'll never fully solve your issues that you get when dealing with lower back pain, because without the proper exercise, your muscles will never strengthen up to the way they used to be, and you're just going to be weaker, and the back pain will never fully go away. It'll always end up coming back unless you take care of it properly. But that being said, there's so many different forms of therapy that we can be looking at. These are just a few examples that we do have. And when it comes to looking into therapy, always go to your doctor or your family doctor to make sure that you're looking for the right one for your type of pain. You never want to try doing any of this on your own without a proper referral, because again, you might not even be having that type of back pain that needs one of these forms of therapy. So a few of them are, as you can see here, is muscle relaxants. That is very good for short-term pain release. It'll loosen up your muscles, causing you to have better movements with less pain and stuff. As well as narcotic pain medications, that's more stronger forms of medication that'll really focus on killing the pain. Again, this is all just so short-term forms of treatment towards lower back pain, and it will not solve it in the long run or long term. You can get stuff as back braces, but if you abuse back braces, that's going to be causing your core muscles not to be getting used as often because you're relying on that back brace. So overusage involving that can cause issues. There's injections you can get, or you can go see a form of specialist such as a chiropractor, acupuncture, or massage therapist, and they, in their own field, will do forms like crack your back, stab you with needles, not in a bad way, or give you a massage to get out the knots and kinks that you have in your back that can really help loosen the tension you have in your compressed nerves and muscles. Again, if you don't do this hand in hand with exercise, though, it will never fully solve your back pain issues. And for the final way that you want to deal with lower back pain is the right mindset. This is often overlooked by many people, and it's quite a shame because it has such a big play in how it affects your belief, your emotional responses, and your outlook towards the pain you've had can greatly affect on how well you want to yourself want to deal with it, or how often you'll believe your doctor, even if he's saying, oh, I think you should do this. If you're all skeptical and negative about it, you won't be listening to your doctor properly, and that's going to cause you issues. And when you're diagnosed with it, it's important that you do choose that right treatment option by going to your doctor. Because if you try to diagnose yourself, unless you're a specialist in that field, it's not going to cause the right courses of action most of the time. And if you just neglect those factors, then it's going to lead to patient suffering. You know, it'll affect your work life, your home life, because you're not going to be in that proper positive mindset that's going to really help you push through everything you need to do when dealing with lower back pain, because it's quite hard to deal with and it's not an easy thing. So one thing I want you guys to try here is, and this is, you can use this for many things in your life. It's going to help you maintain that healthy mindset and give you good drive when you're trying to accomplish anything. But for this instance, I want you guys to write down reasons why someone will want to, would want to get rid of their lower back pain. So, an example here would be not being able to enjoy time with your children or play with your kids. You can't be out and active with them, picking them up and whatnot, because your lower back pain is causing you so much pain, and it really will affect your time you can spend with your own children. Or look in the work aspect where you're at work and you're not being able to perform to your maximum potential. That's going to look bad on you as an employee and might cause you to lose your job, which would affect so much more in your life. Those are just a few things, so go ahead, write them down, and also use this practice for other things, goals you set. Always write down a why, and it will really help you stay driven towards what you're trying to accomplish. So, in concluding here, we're looking at how everything works in a combination together between the exercise, the therapy, and that proper mindset that's really going to help you deal with your lower back pain when you involve all three together. It's not one thing of another. When you combine all three together, you're going to be getting the best results for solving your lower back pain issues that you can have. And the only other option I've left out in this presentation is surgery treatments. That's kind of its own field that I didn't want to get into too much. So all of these treatments are non-surgery related, and they're available to almost anyone who has moderate to even a little severe lower back pain. But when you do it, you got to make sure you have that exercise, therapy, and that proper mindset when dealing with lower back pain. And lastly, here's my reference list. These are the references I used. I really appreciate you guys for tuning in and watching this presentation on how to deal with lower back pain. Thank you.